Hello, my name is Dr. Michael Silva, and I'm the Vice President of Medical Affairs for UPMC Health Plan. If you're a parent with children from the ages of 6 months to 24, this information related to the H1N1 or swine flu virus is meant for you. What I'd like to do is review some of the most frequently asked questions that people have related to the H1N1 flu, particularly as it relates to children. One of the most frequently asked questions is, what are the symptoms of H1N1 flu? In general, the symptoms are quite mild and really are very similar to those of the seasonal flu. They include fever, cough, sore throat, runny nose, body aches, headache, chills, fatigue, and sometimes vomiting and diarrhea. Another question is, how do I prevent my children from getting the flu? The most important thing is to have your children vaccinated. So contact your physician and identify whether the physician is able to offer the flu vaccine for you. In addition to that, a number of community sites will be available in the near future that will also offer the vaccine. When you're thinking about getting the H1N1 flu vaccine, make sure that you ask and consider the seasonal flu vaccine as well, not just for your children, but for yourself. It has been identified that this year will be a season when many people will probably contract both H1N1 and seasonal flu, so protect yourself and make sure that you get vaccinated. One of the other questions is, how can I protect my children from getting the flu? And also, how can I protect them from giving the flu to other children that are their classmates? One of the most important things is to make sure that if your children are coughing or sneezing, that they cover their mouth to protect the spread of the virus. In addition to that, washing their hands is very important. It's important for all of us. And washing our hands or using a hand sanitizer is one of the better ways of protecting the spread of the virus. In addition, children should try to avoid rubbing their eyes or rubbing their mouth when they haven't washed their hands. They may carry the virus in their hands and then become infected from the virus. Another question is, what should I do if one of my children actually develops the flu? Most children do very well and recover quickly with rest and drinking plenty of fluids. We should always treat the symptoms if they're bothersome, but remember, children should use acetaminophen rather than aspirin to treat fever and body aches. So as you use over-the-counter medications to treat the symptoms that your children may have, ensure that aspirin is not one of the ingredients. If your children develop more severe symptoms that are concerning to you, such as shortness of breath, extreme fatigue, if their skin changes color and becomes pale or bluish, or if your children actually seem to be recovering from the flu and then get sick again with a return of fever, please call your doctor. These are symptoms that should be treated by your physician immediately. Lastly, if you're interested in more information, where can you find it? We recommend that you visit our website, upmchealthplan.com, the website for the Pennsylvania Department of Health, or the Allegheny County Department of Health. Also, the Center for Disease Control has a website with a lot of clinical information related to the flu and can be very helpful.